Hi, everyone. My name is Carolyn Vollmer. I am so happy to be a part of this Healthy and Happy Lifestyle Summit this week. I want to say special thanks to Dr. Ajmani for inviting me to be a guest. I'm a physical medicine and rehabilitation specialist in Grand Rapids, Michigan, and I typically work with patients to develop a rehabilitation plan. Physical medicine and rehab is a lesser known specialty amongst the medical specialties, and we work predominantly with a team. Physical therapists, occupational therapists, speech pathologists to develop a good rehab plan for a patient. So I work predominantly with patients who have joint and spine conditions. That being said, or maybe pain related to a back injury. But as we all know, many lifestyle factors play a role and contribute to their current condition. So my passion for lifestyle fits in really well in terms of discussing nutrition, exercise, social connectedness, lifestyle, and a variety of other lifestyle modifications you'll learn about this week. One of the pillars of lifestyle medicine that I'm going to be talking about in exercise and eating, how to optimize your diet to power your fitness today, is physical activity, obviously. One of the pillars that we're focusing on. Another pillar is plant-based nutrition, striving to eat foods that are predominantly unrefined and natural in their form to optimize your health. There's a ton of misconceptions out there about what you need to eat to fuel your body for exercise. I'm going to share with you first some exercise recommendations for all age groups, and then how lifestyle medicine can plant forward your physical fitness. And hopefully what I'll talk about today will easily fit into your life, and you can incorporate it as part of your daily routine. I am a mom of 3 boys, so I get it. Exercising is not an easy thing to always fit in. I'm 11 months postpartum with my 3rd. Physical fitness has become a habit for me. It's not something where I have been naturally thin-framed. I have to really focus on what I'm eating and doing to maintain my health. My journey to plant-based, which is one of the pillars of lifestyle medicine, has been a long one. I was raised on meat and dairy. About 7 years ago, I became pescatarian, and then have been becoming more plant-based over the last few years. I am here with you to answer any questions at any point in time. Dr. Nyson, Dr. Patel, Dr. Brangman, Dr. Mittal, and Dr. Mendez are particularly doing some of the lectures this week focusing on nutrition. And tune in there, so you'll get a little bit more information about how to optimize your diet as well. But today, we're going to focus on exercise and its relation to what you're eating. So what is exercise? Exercise is actually purposeful physical activity that is organized, planned, routine, reoccurring to improve your overall health. Fitness is actually the outcome of exercise. So what you do in terms of activities that you enjoy, leisure activities, when you can do them with a lot of energy, that's a result or the outcome of the exercise and the effort that you put in. We talk about physical activity, increasing your physical activity. We understand that physical inactivity, the reverse of that, actually is a leading factor for global mortality. Trying to remain active improves your health, helps you to maintain and gain more control over your weight, and keep a healthy weight once you optimize it. When you're physically active, you have less risk of developing disabling conditions and a less chronic disease rate, such as developing type 2 diabetes, arthritis, or hypertension. You also can have a decreased risk of developing dementia as we age. More importantly, there's a decreased risk of developing specific types of cancers, such as breast, colon, bladder, endometrial, esophageal, kidney, lung, and stomach cancers. So I guess you can say, as the cliche is, exercise is medicine. It is medicine. And it's been proven over time in numerous studies that the more physical activity we do, the better it is for our overall health. Other ways, in terms of lifestyle medicine pillars, physical activity also improves your sleep onset, duration, and quality. Dr. Soria will be talking a little bit about sleep today as well. It can also improve your concentration, how you think. So help you regulate your emotions and decrease the sensation of anxiety the more physical activity you do. Physical activity also improves your bone health and reduces the risk of falls in the elderly. Let's take a minute and think about how much exercise should I actually be doing? Well, based on the 2008 physical activity guidelines, you should be doing about 150 minutes a week of moderate or 75 minutes a week of vigorous physical activity. That averages out to about 30 minutes about 5 days a week. Moderate physical activity is defined as like a brisk walk, and vigorous physical activity is defined as running, like jump roping, or higher level exercise. You can see even more benefit from doubling that and doing 300 minutes a week of moderate physical activity or 150 minutes of moderate and vigorous physical activity mixed. Dr. Greger, who's one of our lifestyle medicine gurus, suggests that doing 90 minutes a day of physical activity is best for weight loss and longevity. When you think about your kids, a lot of them are inside right now. They're not doing as much activity as they normally would. For 3 to 5 year olds, you want to have them just try to be physically active throughout the day as best you can. And for 6 to 17 year olds, you want them to try and get at least 60 minutes or more a day of moderate to vigorous physical activity, and vigorous being at least 3 days a week. I think a lot of kids are not meeting these guidelines currently. So just as parents and caregivers, recognizing that our kids need a lot of exercise to optimize their bone health and reduce the risk of developing chronic diseases as they age will help instill that this beautiful summertime's coming, that we all focus more on getting our kids outside. In terms of resistance training, how much strength training should I do? Well, 6 to 17 year olds need muscle and bone strengthening activities about 1 hour, 3 days a week. And adults age 18 and over should be strength training about 2 to 3 times a week on non-consecutive days, working all their major muscle groups. So if you think about it, if you are doing cardiovascular exercise about 5 days a week for 30 minutes at least, you could be doing strength training on those other days of the week. Flexibility, balance are also very important for your health. Trying to get at least 10 minutes of stretching 2 to 3 times a week after some of your activities of all your major muscle groups is very beneficial for your health. Also, when you talk about balance, one way to do it is focusing on doing yoga. Dr. Sharma will be doing a lecture on yoga. And Tai Chi is actually shown to reduce the risk of falls in older adults if you do that about 3 or more days a week. Let's shift gears a little bit and talk about carbs. Carbs, they've given a bad rap, but carbs are good. The unprocessed versions, fruits, oats, sweet potatoes. Athletes in the general population typically need about 55% of their total daily intake from calories from carbohydrates. They're the energy that your brain and muscles need. When I think about when I went low carb at some point in my life, how foggy my brain felt. And it's just because your brain is not getting what it needs to power it. So don't go low carb if you're looking to give your body the energy it needs to boost your endurance and performance. The latest research suggests that in order to maximize gains in strength, consuming carbs in a range of about 5 to 7 grams per kilogram is productive for strength gains. Well, should you go low carb? Well, some people do it to lose weight, but we're talking about how to combine this with exercise. If you're thinking about exercising and gaining muscle mass, it's actually not good to go low carb. There was an 8-week trial where they took subjects who were fed the same amount of calories and protein, but varying amount of carbs. Those who ate a normal amount of carbs gained almost 3 pounds of lean muscle mass, but those in the low carb ketogenic group didn't gain any muscle mass. Therefore, carbs, you need them. What about meat? I thought I needed meat to be strong and powerful. Well, the tide in education is, especially in lifestyle medicine, which we're focusing on this week, is to shift towards more of a plant-based diet and try and minimize your animal product intake. Animal products are actually full of saturated fats, cholesterol, and they lack fiber. They're pro-inflammatory in your body, so that increases the risk of developing cardiovascular disease and certain cancers. The inflammatory markers actually rise after you consume animal products within hours, and they can be picked up within days in your body. When you start cutting down on them, you can actually see the inflammatory markers decrease in your body. Well, what if I'm athletic? Will it just override the effects of eating meats? Well, maybe not. Even athletes have cardiovascular disease. And now there's a lot of variables that play into getting cardiovascular disease, but a 2017 study showed that 44% of middle-aged and older endurance cyclists and runners had coronary plaques. So even if you're at the peak of your fitness, you're still at risk of developing cardiovascular disease. Your diet plays a role in this. So how do you optimize it? Well, try not to make those plaques symptomatic. And the best way to do this is to improve the blood flow and not eat foods full of saturated fats and cholesterol. So, thus, maybe transitioning to incorporating more plant-based foods as your foundation will do just that. A diet that is rich in plant-based sources, like not processed, natural fruits with natural fruits, legumes, vegetables, whole grains, nuts, and seeds are what you should be looking to incorporate in your diet. And actually, a low-fat vegetarian diet is the most effective dietary pattern clinically shown to reverse plaque formation in your hearts and in your arteries. So if you think about the Ornish diet, you can look at that for research-wise, and Dr. Esselstyn has published a tremendous amount of research showing that a low-fat, plant-based diet was able to reverse and prevent major cardiac events. Eating plant-based also decreases the other key contributors to atherosclerosis, including lowering your cholesterol, decreasing your blood pressure, decreasing the likelihood that you'll gain weight, and decreasing the risk of developing diabetes. Talk about fats. So you want to choose foods that are low in saturated fats, and eating more plant-based monounsaturated fats, such as nuts and avocados, may make you feel more energetic than consuming fats from meat and dairy in some studies. There's actually been studies that compare exercise between groups of people who consumed identical amounts of calories in the diet and the same amount of fat, but one got their fat from saturated fats and one got theirs from the monounsaturated fats. But those who got the monounsaturated fats actually tended to increase their activity levels up to 15% more. So what you eat may make you feel better, and therefore you choose to exercise more. What about protein? So if I'm eating plant-based, if I'm a vegan, how do I get enough protein to work out? Well, peanut butter sandwiches have as much protein as 3 ounces of beef. The average plant-based person gets more protein than they need, sometimes almost 70% more. And it's true that animal-based proteins are more concentrated source, so you might be able to get to it quicker. They're a little bit more readily digestible. But if you just eat a variety of foods throughout the day, focusing on, like we talked about, all of our key plant-based groups, you will get enough. Tempeh, tofu, legumes, nuts. Eat a variety, and you'll get all the essential amino acids that you need. Compared to carbohydrates, proteins are used only minimally for fueling your body. Their primary function is more so to build and maintain muscle tissue. Plant-based protein sources are better because they contain the fiber in those complex carbohydrates. You're going to learn more about what a critical role fiber plays in your health when Dr. Mendez talks about gut health. What I can say is that fiber actually improves your satiety, stabilizes your blood sugars, so that consuming plant proteins can actually help your endurance levels. The recommended daily amount for the average adult is about 0.8 grams per kilogram of body weight per day of protein. If you're looking to be an athlete and build muscle mass, you may need to consume some more protein, anywhere from 1.2 to 1.7 grams per kilogram of body weight per day. Higher protein diets may be beneficial for resistance training and can increase your muscle mass. What about iron? Heme iron versus non-heme, which is in plants. If you eat a varied plant-based diet, you shouldn't be in trouble with your iron levels. The issue for some is that we don't absorb plant-based proteins as well, so sometimes pairing it with a vitamin C containing food will help improve the absorption. Most people, depending on where they are, need about 10 to 15 milligrams per day, but iron loss may be, or needs may be different depending on if you're pregnant or not, or you may lose more iron through sweat and GI losses when you're an athlete. Iron-rich foods, good examples of that are like lentils, soybeans, brown rice, quinoa, pumpkin, squash, sunflowers, cashews, variety of collard greens. So you can find iron in everything you need. You don't necessarily need to take a supplement if you eat a varied plant-based diet. I can't say enough about water. At baseline, we need about 2 to 3 liters, aka about 60 to 100 ounces of water per day, which is like that 8 by 8 ounce rule. But remember, when you're exercising, you need about 12 ounces 2 hours before a workout, about 12 ounces for every 20 minutes of exercise you're doing, and up to 24 ounces for every pound of water weight you lose after exercise. Remember, you don't weigh yourself right after you get off done exercising, because that's just a water weight loss, unless you want to know how much to replenish. Vitamin B12 is a supplement that may be taken if you start to increase the predominance of plant-based foods in your diet. B12 is not naturally occurring in plants and is wiped out by a lot of our cleanliness habits that we have. You'll need about 250 micrograms of B12 a day, and some people choose to take daily supplements or take them once a week at a larger dose. To optimize your bone health when you're exercising, you want to focus on getting a good amount of calcium, which can be found in a lot of greens such as broccoli, kale, and bok choy, getting about 1,200 milligrams a day. For an example, plant-based milk such as soy milk have about 200 milligrams in a cup. Vitamin D, you can get it from the environment in the summertime, but you also may take supplements of anywhere from 600 to 2,000 units a day of D3. I personally take a supplement that has B12 and vitamin D and some DHA in it, combination, a complement brand, and I enjoy that as a supplement to make sure that I get enough B12 in my diet and then the other nutrients. Exercise timing. So thinking about how much exercise you need to do and when you should do it is kind of important when you're thinking about if your goal is to focus on fat loss. Exercising in a fasted state at least 6 hours before your last meal is shown in studies to actually help you lose fat, and your body is actually forced to dip into using glycogen and fat stores at this time. You could also do it any other time of the day if you at least had 6 hours between when you last had your meal. Diabetics, you need to consult with your primary doctor on when you should eat. You may need a more personalized plan and time your exercise and eating differently. Think a little bit about your exercise mind frame. I think it's valuable to discuss your reason for exercising. If it is to lose weight, then the best way is to focus on changing your eating habits. If you focus on exercise as being just an enjoyable movement rather than a means to torment yourself for the cupcake you ate, you may have less of a reward phenomenon afterwards and not trigger eat a bunch more as a reward to yourself for actually exercising. So really focus on just enjoying the moment, being lost in the moment, the added purpose that exercise does for you, and don't put too much pressure on yourself in terms of your exercise regimen. If weight loss is your goal, then changing your nutrition is the best way to go about that. In summary, in order to power your fitness, you want to choose a variety of calories from a healthy selection of predominantly plant-based foods that are high in carbohydrates, low in saturated fats, and adequate in protein sources, depending on the type of training you're pursuing. I would consult with a specialized lifestyle medicine physician or your primary care doctor to get your own personalized medical advice before starting on an exercise program. The purpose of this is solely educational, and I hope that you enjoyed it. Stay tuned for excellent lectures this week. Feel free to follow along with me on social media, Carolyn Vollmer, MD on Facebook, and PlantBased Lifestyle MD on Instagram. Thank you so much for coming, and I hope you have a wonderful day.